Hello, my name is Leah and I'm one of the sisters on the Cardiac Intensive Care Unit, or Cardiac ICU for short. The team on Cardiac ICU will provide specialist care for you as you recover immediately after your heart surgery. Our department has 16 intensive care beds and a large team of doctors, nurses, physiotherapists and healthcare assistants. We also have housekeepers and domestic team members to help you ensure your comfort during your stay. When you are transferred here from the operating theatre, you will have one dedicated ICU nurse caring for you at all times and will see a doctor every day. For the first 4 to 6 hours, or in some cases longer, you will remain sedated and asleep. You'll have a range of machines and monitoring equipment around you. These provide us with information including your continuous heart rate, blood pressure and oxygen levels. You will have a breathing tube in your mouth connected to a machine called a ventilator. When the time is right, this will be removed, but while it's still in place, you won't be able to talk. As you begin to wake up, you may find that it makes you cough. Once the breathing tube has been removed, you will receive oxygen via a mask. At this point, you may have a weak voice and experience a dry mouth or a sore throat. Your nurse will advise you when you can eat and drink in the meantime. We can keep your mouth moist with water. You will be connected to several lines, drains and attachments to begin with, including a drip in your neck for administering medications, a line in your wrist to monitor your blood pressure, chest drains from your surgical site, a tube in your nose which delivers nutrition to your stomach, and a urinary catheter. You may also have a temporary external pacemaker known as a pacing box. This manages your heartbeat following surgery. Some of these lines and drains will be removed the day after your surgery. Others will stay in for 3 to 5 days. Although these can be a little uncomfortable, they should not be painful, so please tell a nurse if they are causing any pain. The cardiac ICU ward round usually begins around midday. The consultant will review your progress and outline plans for the next steps of your care. This is a good opportunity to ask the doctors any questions you may have. You will be seen by our physiotherapy team and be encouraged to mobilise, getting up and out of bed, even walking around. If the physiotherapy team are unavailable, the nursing staff will help you with this. Don't be surprised if this happens on your first day after your surgery. We understand moving around immediately after surgery can be quite daunting, but we are here to help you make it easier for you. You will continue to receive treatment on Cardiac ICU until you are ready to be transferred to Cardiac HDU, Cardiac High Dependency Unit, or the ward. We try our best to transfer you during the day, but sometimes we have to transfer patients later at night or very early in the morning, depending on if there have been any emergency admissions. The department can be busy, and some people find that the unfamiliar environment and the alarms and beeps of the machines can sometimes make it difficult to sleep. We can offer earplugs and eye masks if needed. It's not unusual for some patients to experience confusion and delirium at this stage in their recovery and for a period of time afterwards. We will do our best to help reorientate and reassure you if you experience this. Seeing familiar faces can be beneficial during this time, so we encourage visiting. A maximum of 2 visitors are allowed at your bed space, and we have a waiting room on the unit. We ask that visitors bear in mind that mornings are busy for you with doctors' ward rounds, physiotherapy and line removal all going on, and that you will need plenty of rest in the afternoon. No food and drink is to be brought into the ICU unless discussed with the nurse in charge. Strictly no photos may be taken on the unit. This protects everyone's privacy and dignity. We understand that having heart surgery can be worrying and exhausting time, but we aim to make your experience as comfortable and smooth as possible. It's possible that you may forget your stay with us, but we offer a follow-up clinic should you have any questions about your treatment and stay. We look forward to welcoming you to Cardiac ICU. If you are unsure of anything, please don't hesitate to speak to one of our experienced team.